Welcome to Chapter 4, Carbohydrate, Sugar, Starch, Glycogen, and Fiber.
Glucose, Part 2 by Professor Tammy. Learning objectives. 1. Itemize the effects of added sugars on health. 2. Describe how carbohydrate affects dental health. Recommended intakes of sugars. Updated food levels. They separately list added sugars. If you look at your food facts labels, you'll see that there's a separate section for added sugars. How to estimate sugars. The dietary guidelines for Americans urge consumers to limit intake of added sugars to 10% of total kilocalorie per day. Added sugars, less than 10% of energy intake. 5% or less, even more beneficial. So the less added sugar you have, the better it is. And it also impacts on other food groups too. So there's no upper limit tolerable level establishment. So they don't have that chart that says, okay, how much is too low, how much sugar is too little for you. High fructose corn syrup, HCFS, is more harmful than sucrose, is it? Research indicate virtually identical metabolic effects, so it's about the same metabolically. Intakes of all types of added sweeteners too high. And if you want to know more about high fructose corn syrup, you can click on the hyperlink. Forms of sugar commonly added to foods. Here's a list of some sugars so you can look at it. Maybe you can use it for your own recipes. And these are terms used to describe grains and cereals on nutrition labels. And I thought that might be interesting, and especially if you're interested to understand what the ingredients labels really mean. Especially the one that says stone grail. Remember, we kind of mentioned it when we spoke about the food facts label about fiber. Alternative sweeteners. Artificial sweeteners are non-nutritive sweeteners. GRAS stands for generally recognized as safe. Sugar alcohols, polyols. When you see OL at the end of a word, it means alcohol. Sugar alcohol provide kilocalories, and there are benefits and side effects to it too. Nutritive sweeteners contain 4 kilocalories energy per gram, just like carbohydrate. And nutritive sweeteners are sucrose, fructose, honey, brown sugar. So sugar alcohols contain 2 to 3 kilocalories of energy per gram, which is less calories compared to the 4 kilocalories per gram. So sugar alcohols have the benefit of a decreased glycemic response and decreased risk of dental caries. So unlike sugar, real sugar, which can cause dental cavities, sugar alcohols have a much less chance of causing dental caries. Non-nutritive alternative sweeteners provide little or no energy. They their development are to sweeten foods without the usual risk, so they were created for this purposes. No acceptable daily intake, ADI, has been set for saccharon, which is sweet and low, but it has been removed from the list of cancer-causing agents. ADI's acceptable daily intake have been established for ACE sulfame K, such as sweet 1 and Sunnet, aspartame equal. Cellulose, Splenda. Sugar alcohols and non-nutritive sweeteners. Sugar alcohols provide half the calories of sugar. They have lower glycemic response. They're also safer for teeth than regular sugar is. And here's a video which has a hyperlink. All you have to do is click it. This is a video about sugar alcohol. So here at the table, foods and beverages that a child and adult would have to consume daily to exceed the ADI for aspartame. So here's a chart of it. Sources of added sugar in the United States diet. So when you look at it, Most of it are beverages, not counting milk or 100% juices, so that's about 47% of foods that have added sugars. And snacks and sweets are 31%. And if you want to look at dairy, it's about 4%. And juice, fruit juice, is about 1%. And just to note that sometimes juice have more sugar than soda, so you really have to look at the food fact label to see what's up there. Glucose and fructose in common added sugars. Like the high fructose corn syrup, it has a little more fructose than there is glucose. And sucrose, it looks like it's about the same between fructose and glucose, at least by looking at eye level. And honey is almost 50% fructose and glucose. And corn syrup is, wow, 100% glucose. Dental caries, or what we call it, cavities. Most Americans eat too little fiber-rich carbohydrates. Bacteria ferment sugars producing acid, which erodes the tooth enamel. That's the outer layer of the tooth. Food factors associated with tooth decay. That means, these are the things that causes or increases your chance of having tooth decay. Is the time of food in the mouth. The longer the food is in your mouth, the longer you're allowing the bacteria from the food to kind of thrive in your mouth. Sticky food, the sugar can get stuck on your teeth, in between your teeth. Frequency of sugar consumption, the more often you consume sugar, the more likely your teeth get introduced to sugars more often. So it also depends on your food and beverage choices. Like, are you going to consume foods and beverages that have sugar? Whole grain foods are much more healthful sources than foods with added sugar or fiber. Factors associated with tooth decay. So I would ask you to review that, like the time of the food in the mouth, the stickiness of the food, and also the frequency. How often do you eat these sugary foods? So on the right hand side, you see cavities. So these are what a child's cavities can actually look like. So a lot of times when the teeth becomes brown, that can make the mouth smell. And you might think, oh, okay, kids are going to have their baby teeth and it'll come out and they can take care of the adult teeth. It's really about starting the habit young, taking care of your teeth now, because when you know how to take care of your teeth now, most likely your adult teeth will also be well taken care of. So when you look at the picture here on the far right, healthy primary baby teeth, this is mild tooth decay. It's usually because maybe they're drinking a milk bottle and the bottle goes here, and a lot of times this can happen. So when a child drinks milk, they can end up forming a hole there where the cavity is, the milk sugar, especially when children drink milk to sleep. Moderate decay, you see some cavities here, but this is really bad. I've seen children where they barely have any teeth. When they chew, it's really with their gums because their teeth are so short, and it could be all over too. It's all about taking care of the teeth. And if you want to see more dental decay photos, you can see them here.
See you soon. And remember to read the book.